We love them and would do just about anything to protect them, and we want to make sure they live comfortable, healthy lives. Our pets, be they dogs, cats, rodents, birds, lizards, fish, or anything else, they are our companions and we will get them what they need to keep them happy and healthy. To that end, the Burlington Public Library's Friends of the Library group held a talk on pet first aid with veterinarian Kathleen Hanson to give pet owners some basics on what to keep an eye on when it comes to pet health and how to identify what is an emergency and what can be treated at home.
I was trying to let people know which things they could treat at home versus which things really need to be treated by a professional. Examples are wounds, so small wounds you could treat at home, broken toenails you probably could treat at home. Seizures need to be seen, but as long as they stop seizuring and it's a single seizure, you can wait and see a regular practitioner in the morning. Seizures that continue more than 5 minutes need to be treated right away. Large lacerations, animals that impale themselves, animals that vomit even if you withhold food and water need to be treated.
When it comes to problems that many pet owners overreact to, Dr. Hanson said the biggest culprit is what pets leave on the ground or in litter boxes.
Probably the biggest one's diarrhea. So I get a lot of patients coming in for diarrhea. Diarrhea is inconvenient. So I think if they're waking them up in the middle of the night, there definitely are medications we could put them on. But a lot of pets, if you just did a bland diet, they wouldn't have to come in.
One of the best ways to ensure your pet is healthy is by maintaining a good environment at home and by paying attention to what they eat.
Cats, make sure there's no strings around. If your cat eats plastic, clean all that up. Food, I recommend feeding a high quality food that has been tested by a larger company. There's been some issues recently with dog food causing dilated cardiomyopathy, and they're not sure why, but it's been more the boutique grain-free diets. So I tend to recommend sticking with like Hills or Science Diet, Purina, or Royal Canin.
Dr. Hanson also recommends pet owners have a pet first aid kit handy, but not to worry about supplying more than the basics.
I tend to recommend minimal first aid kit. Styptic powder, which is a powder that will stop bleeding. I recommend tweezers, so that if they have a stick or tick on them, you can take that off. Some type of bandage material. My favorite is vet wrap, which is a slightly elastic material that you can put around. Probably antibiotic ointment. Those are probably the big things I'd put in. I mean, to me, once you start getting into needing a lot more things, you probably need professional help.
Finally, since animals can't talk and tell us what they're feeling, it is important to know certain behavioral clues to keep an eye out for that can tell you that your pet may be sick.
So cats, behavior change a lot of times is all we have to go on, because cats, most people with a dog will take the dog for a 15 or 20 minute walk every day, and they notice if the dog only walks 5 minutes. Cats, people don't do that. So cats that are hiding, that don't want to eat, that look at the food but don't eat it or won't even come, if they're hiding in a closet, hiding under a bed, that's definitely a concern. Dog behavior changes, not wanting to walk as far as they used to or getting winded more quickly, I would recommend having them looked at. Any sudden change in aggression with either dogs or cats is a concern. So if you had a very docile pet that all of a sudden is like growling at people or snapping at people, that could be pain, it could be a brain issue.
At the Burlington Public Library, I'm BNEWS Director Rich Hosford.